If you are over 50 years old, listen carefully right now. This message may help you protect your visual health. Pain behind the eye is not always migraine, and understanding its causes can make a big difference. Many people ignore it, thinking it will go away, but after 50, it is wise to observe symptoms. The body changes and some illnesses change as well. That is why today we will speak clearly and calmly. We want to give you useful, simple, and reliable information. Stay with me until the end because this is important. Pain behind the eye can feel deep. Some people describe it as constant internal pressure. Others feel it sharp like small electric shocks. Sometimes it appears on only one side. At other times, it affects both sides simultaneously. It can last minutes, hours, or even days. Sometimes it improves with rest and darkness, but other times it returns with greater intensity. Not all pain is the same, and not all pain has the same cause. After 50 vascular risk increases, nerve alterations may also appear. Pressure inside the eye can rise. Even sinus infections can cause similar discomfort. That is why we should not automatically assume migraine exists, but it is not the only explanation. A correct diagnosis requires professional evaluation. Observing details of the pain helps greatly. Intensity, frequency, and triggers matter. Listening to your body is the first essential step. Let us begin by talking about facial neuralgia. Neuralgia occurs when a nerve becomes irritated. In the face, there is the trigeminal nerve. This nerve transmits sensation from the face to the brain. If it becomes inflamed, it can cause intense pain. The pain is usually electric and sudden. It lasts seconds but can repeat many times. Touching the skin can trigger it, even speaking or chewing food. Many people confuse it with a dental problem. Neuralgia is not always constant. It can appear in unexpected episodes. Between attacks, the person may feel fine, but fear of the next episode remains. With age, nerves change in sensitivity. Some blood vessels may slightly compress them. That compression produces intense, painful signals. Although frightening, it has specific treatment. There are medications that stabilize nerve activity. Consulting early greatly improves prognosis. Now let us talk about important vascular problems. After 50, arteries lose elasticity. High blood pressure can affect eye circulation. High cholesterol also has negative influence. A condition called arteritis must be monitored. It causes inflammation of the temporal arteries. It can cause pain in the temple and eye. Also sensitivity in the scalp. In some cases, it produces blurred vision. It requires immediate, urgent medical attention. Arteritis may be accompanied by fatigue. Some people experience persistent low-grade fever. There may also be loss of appetite. The pain is not like usual migraine. It is often deep and constant. If untreated, it can affect vision. That is why we must never ignore new symptoms, especially if they are different from previous ones. Early evaluation allows proper treatment to begin and prevents potentially serious complications. Another relevant factor is intraocular pressure. Inside the eye, fluid circulates constantly. If that fluid does not drain properly, pressure increases and damages the optic nerve. This condition is known as glaucoma. Many times it is silent at first, but in some cases it produces intense pain. It may be accompanied by eye redness, also halos around lights, and a marked feeling of internal pressure. Acute glaucoma is a medical emergency. Pain can be severe and sudden. Some people experience nausea and vomiting. Vision may quickly become blurred. With these symptoms, go immediately to emergency care. Timely treatment protects vision. Annual ophthalmologic checkups are essential. Even if there are no apparent discomforts, measuring eye pressure is a simple test, and it can save sight in the long term. Let us not forget frequent sinusitis. The paranasal sinuses surround the eye cavity. When inflamed, they create facial pressure. Pain increases when bending the head. It is usually accompanied by nasal congestion, also thick discharge and general discomfort, although it is usually less dangerous. It must be distinguished from vascular causes. Proper treatment relieves symptoms quickly. A clinical evaluation clarifies the diagnosis. Muscle tension also plays a role. Neck and shoulders accumulate chronic contractures, especially in people who use screens. Poor posture generates referred pain. That pain may be felt behind the eye. It generally improves with rest and stretching. Gentle massage can relieve tension. However, persistent pain requires review. Not everything is stress or fatigue. Prudence is always wise counsel. Observing characteristics of the pain helps greatly. Is it throbbing, following the heartbeat? Is it constant, like sustained pressure? Or does it appear as brief electric shocks? These details help the professional. Keeping a daily record can be useful. Write down duration, intensity, and associated symptoms. Also factors that worsen it. That information facilitates accurate diagnosis and avoids unnecessary later studies. After 50 regular checkups, become a fundamental part of self-care. Controlling blood pressure is essential. Also, blood glucose levels and cholesterol profile periodically. These measures reduce vascular risk. A healthy lifestyle helps moderate physical activity, improves circulation. Sleeping well supports body balance. Small habits create great benefits. Fear can intensify pain perception. When we do not know the cause, we imagine negative scenarios. Proper information reduces unnecessary anxiety. Speaking with a doctor provides reassurance. Clear communication strengthens trust. You are not exaggerating by consulting. Your well-being deserves professional attention. Pain is a message from the body. Ignoring it does not make it disappear. Listening responsibly is a wise act. Family can provide valuable support. Sharing symptoms helps decide to consult. A companion makes it easier to remember medical instructions and also brings emotional calm. After 50, teamwork matters. Patient, family, and professionals collaborate. Health is a shared project. No one should face uncertainty alone. Seeking help shows strength, not weakness as some believe. Remember important warning signs. Sudden loss of vision in one eye. Persistent double vision without explanation. Weakness in face or arm. Difficulty speaking clearly. Severe pain with continuous vomiting. With any of these symptoms, go immediately to medical services. Time can be decisive. Acting quickly protects vital functions. Most pain is not serious, but distinguishing it properly is essential. Not all cases require hospital emergency care. Some can be managed outpatient. However, the decision must be based on evaluation. Avoid repeatedly self-medicating, especially with strong painkillers. They could mask important symptoms. Consulting allows specific treatment and proper follow-up according to diagnosis. If you already suffer from known migraine, observe whether the current pain is different. A change in usual pattern deserves attention. Age modifies the presentation of diseases. What was once typical may evolve into another condition. That is why conscious comparison helps. Do not resign yourself to living with pain. There are solutions for many causes. Quality of life can improve. Adopting a healthy routine is an investment. Balanced nutrition supports the vascular system. Reducing salt helps control pressure. Avoiding tobacco protects delicate arteries. Maintaining adequate weight reduces risks. Proper hydration supports eye function. Resting the eyes during prolonged reading. Adequate lighting reduces visual strain. Small daily actions add up to well-being. Consistency produces lasting results. It is also important to exercise the mind. Reading, talking, learning new things stimulates healthy neural connections. An active brain responds better. In stressful situations, conscious relaxation can help. Deep breathing reduces tension. Taking pauses during the day reduces cervical muscle contractures and improves overall body awareness. If the diagnosis confirms neuralgia, there are specific pharmacological treatments. They are not simple common painkillers. They act by modulating altered nerve activity. The doctor will adjust dosage carefully, according to response and individual tolerance. In some cases, procedures are considered when medications are not enough. Each situation requires personalized evaluation. The decision must always be professional. In inflammatory vascular problems, treatment may include corticosteroids, administered under strict supervision. They quickly reduce arterial inflammation. This prevents irreversible visual damage. Follow-up includes periodic tests to control potential side effects. Continuous communication with the specialist ensures safety during treatment. Discipline is key for recovery. In cases of chronic glaucoma, eye drops must be applied daily, strictly respecting indicated schedules. Skipping doses reduces preventive effectiveness. The ophthalmologist will evaluate visual field and the condition of the optic nerve. Follow-up visits are necessary, even if there are no obvious discomforts. The goal is to preserve vision for many more years. If pain comes from sinusitis, antibiotics may be necessary. Also, decongestants under medical guidance. Warm inhalations relieve facial pressure. Rest facilitates proper recovery. Drinking fluids helps thin secretions. Avoiding sudden temperature changes may reduce additional discomfort. Each cause has specific treatment. That is why correct diagnosis is fundamental. Do not underestimate persistent pain, especially if it interferes with activities, reading, driving, or resting. Quality of life always matters. Healthy aging is possible, but it requires active participation. Caring for health is not exaggeration. It is responsibility toward yourself. Your experience deserves to be lived fully, without constant unnecessary pain. You may wonder when to consult. If pain lasts several consecutive days, if it progressively increases in intensity, if it is accompanied by visual symptoms, or if it simply worries you. Listening to intuition is also valid. No one knows your body better. With reasonable doubt, seek guidance. A consultation can give you peace of mind and rule out serious causes in time. Sometimes the answer will be reassuring. Perhaps only temporary muscle tension or a mild episode of sinusitis. Receiving that confirmation brings calm and avoids unnecessary worry. But if a relevant problem exists, detecting it early completely changes prognosis. Prevention is always better than facing advanced complications. Proper information empowers healthy decisions. I want to remind you of something important. Pain does not define your age. Turning 50 or 60 years old does not mean accepting constant suffering. Modern medicine offers alternatives. The key is not to normalize symptoms. Every signal deserves respectful attention. Your well-being is an absolute priority. Listening to yourself is the first act of care. Seeking help is the second brave step. Thank you for staying with me until now. I hope this information is clear and helps you make decisions. Share this message with acquaintances, especially those over 50 years old. It may serve them at the right time. Stay attentive to your health. Schedule your regular medical checkups. And remember that prevention means living better. See you at the next informative meeting.